Healthcare facilities to the pensioners of autonomous and statutory bodies of central government. I am Surya Prakash, Secretary representing the interest of autonomous bodies and statutory bodies of central government on Bharat Pensioners Samaj. I wish to bring to the kind attention of the government through this video that it is very unfortunate that a section of retired employees of autonomous and statutory bodies of central government like Rubber Board, Coffee Board, Spices Board, Central Silk Board, Tea Board, Tobacco Board, Khadi Village Industries Commission, National Council of Science Museum, MPIDA has been deprived of healthcare facilities and they have to spend for themselves towards their hospitalization expenses from out of their pension income. While the government employees are covered under central government health scheme for their medical needs, the employees of most of the autonomous bodies and statutory bodies working under different ministries of central government get medical assistance either under CSMA or CGHS. Only those retired employees of these autonomous bodies and statutory bodies who were under CGHS when they were in service are getting CGHS facility and others are not covered under any other health scheme. They are all getting 1,000 rupees per month as fixed medical allowance, which is not even sufficient to meet expenses towards doctors' consultation charges. We beg to point here that health is not a luxury and not be the sole possession of a privileged few. The enjoyment of the highest attainable standard of health is recognized as a fundamental right of all present and past workers in terms of Article 21 read with Articles 39(3), 41, 43 and 48A of the Constitution as pronounced by the Supreme Court in Consumer Education and Research Center and others versus Union of India, AIR 1995 Supreme Court, wherein the Supreme Court has held that the right to health to a worker is an integral facet of meaningful right to life and have not only a meaningful existence but also robust health and vigor. Therefore, right to health, medical aid to protect the health and vigor of a worker while in service or post-retirement is a fundamental right to make a life of a worker meaningful and purposeful with dignity of person. Several courts have also held that a serving employee who enjoys benefits under CSMA Rules 1944 cannot be left high and dry immediately after retirement for want of medical care. His medical issues are required to be looked into with some sensitivity, compassion and sympathy. It is the prime responsibility of the state to protect the health and vigor of retired government officials, this being their fundamental right under Article 21 read with Articles 39(3), 41, 43 and 48A of the Constitution, and right to health is a human right and questioned as how the government as a principal employer could abrogate the responsibility of taking care of the health of its retired employees. Though the pensioners associations of autonomous and statutory bodies of central government had requested the government for suitable healthcare facilities, the government has not responded positively so far. If the government is not in a position to extend CGHS facilities to the pensioners of autonomous and statutory bodies of central government whose organizations have been established by an Act of Parliament or whose pension and other benefits are regulated in terms of CCS Pension Rules 1972 as amended from time to time and now replaced by CCS Pension Rules 2021, they should be allowed to get their medical facilities under CSMA rules which they were getting when they were in service or any other healthcare facilities where they get medical treatment when they are hospitalized on cashless basis. The government is therefore requested to provide healthcare support on par with the serving employees or CGHS or CSMA rules or any other suitable healthcare facilities to the retired employees of autonomous bodies and statutory bodies of central government also who are in a very small number, less than 10,000, so that they also get medical treatment on cashless basis. Pending grant of suitable healthcare facilities to the retired employees of autonomous bodies and statutory bodies of central government, we also request the Ministry of Health and Family Welfare to instruct all the empaneled hospitals under central government health scheme to extend medical assistance to the pensioners and family pensioners of autonomous bodies and statutory bodies of central government at CGHS rates on payment of cash across the counter so that it will reduce the financial burden of these pensioners at least to some extent, and also as there will not be any financial burden on the part of the government, and to incorporate as one of the conditions in the MOU to be entered with the private hospitals empaneled under CGHS to the extent that pensioners and family pensioners of autonomous bodies of central government have to be extended medical benefits at CGHS rates on payment of cash.